Chapter 7, Principles of Pathophysiology. Topics we're going to cover. We're going to go over the cell. We're going to go over the regulation of homeostasis and what that means in EMS. We're going to cover the cardiopulmonary system, shock, and the pathophysiology of other systems. What is pathophysiology? It's not necessarily the disease itself, but how disease processes affect the function of our body. How is it that they affect how we're feeling, our blood pressure, our vitals, whether we're going to be perfusing or not with specific diseases. This understanding will help you recognize some changes that the patient may go through due to this illness or this injury. It'll also help you recognize the needs of the body. This could be oxygen, sugar, and fluid. Different needs that can be treated with the skills you're going to learn in your EMT1 class and beyond. The cell, basic structure of the human body. The cell membrane basically envelopes and protects the rest of the structures, keeps it all in, and it can allow water and other substances in and out of the cell. This is a way to be able to transport any water or glucose, electrolytes from one area of the body to another. The mitochondria will convert glucose and other nutrients into what we call ATP. You think of it like glucose is like crude oil. They take it out of the ground, really can't be that useful. They can make some things out of the crude oil. You can light it on fire. But during a refinery process, in this case, mitochondria, it breaks it down into a much better fuel, like gasoline. It's a fuel for the cell functions, and without ATP, many of the cell's structures just wouldn't function. It's what makes glucose so important in our activities. This here is a diagram showing the inside of the cell. You can see that there is a cell wall. You can see that there's like DNA type structures, the nuclear cell itself, the nucleus is in the very center of it. You might have covered a lot of this in high school anatomy and physiology. If you've taken any other like biology courses in other schools or college, you kind of see what basic structure of a cell. I said earlier that the cell membrane will allow water and other substances to pass through it. If there is too much water, it can actually become too full to be able to function appropriately. You saw on the other slides here that the right amount of space for all of the structures within inside the cell. You don't want those structures to become squished because of too much water, if it's too engorged with water inside the cell. If it is too little amount of water, it can actually be dehydrated, and then those functions cannot be done because they don't have the mobility. They may not have like a lubrication to be able to move where they need to and function as they need to. Water also affects the levels of electrolytes. Electricity flows much better through water. That's why you are told not to stand in water when there's electrical, or you see in the movies that they use tasers and hit the ground and it electrocutes people, which is not the case, but water does impact electrical functions, and we all need electrolytes to move particles and signals from one cell to another. So water is significantly important in our bodies and our cells. glucose in the cell. Talked a little bit about how glucose gets turned into ATP using the mitochondria. Glucose is highly important for energy. That's the fuel. The crude oil being refined into gasoline to be able to make our vehicles go. It is the building block for energy. Without glucose, there cannot be ATP. The problem with glucose and the cell wall is glucose is a very large structure, and it has a difficult time getting into the cell. That's why we need insulin. The supply of insulin must match the body's glucose. Otherwise, they're going to be either too much sugar or too much insulin. Oxygen in the cell. You guys have heard like aerobic metabolism and anaerobic metabolism. If you go back to medical terminology, the an before the anaerobic means like lack thereof, or in this case, the cellular functions are not using oxygen. The problem when they don't use oxygen, and a lot of time you'll get like cramps when you're running really hard. This is one of the reasons why they don't want you to like swim in cold water, kind of a shock to the body, and your vessels kind of constrict and limit the use of oxygen to cells, and so they'll start to like cramp. Your body can become acidic. What's carried in cells with oxygen is carbon dioxide, and that can increase or decrease the acidity of our blood system and body systems in general. And when something becomes too acidic, just like pouring acid or pouring alkaline on something, it can actually like burn. Our bodies are not meant to be highly acidic or highly alkalytic. We will cease to exist. We will die if our bodies go too far out the norm, either too high or too low. So we need the correct balance of oxygen, and we need to, we can function on some level without some oxygen, but not for very long. There are some bacterias that do not use oxygen, and those are anaerobic bacteria. So if you expose them to oxygen, they will actually die. They don't live outside the body. But there's some that can live outside the body, and those are aerobic. Hopefully that makes a little bit of sense for you guys there. So what does all this mean when it comes to energy? You can see here aerobic metabolism. The glucose is broken down in the presence of oxygen. So the mitochondria helps break it down. It increases ATP, and the CO2 leaves as the oxygen comes in. You can start seeing circular flow. Everything's like working in conjunction with each other. Our acid-base balance is balanced, and there's going to be an abundance of energy. If you think about what will it look like if there is no oxygen in here to help the glucose. So anaerobic metabolism, glucose broken down without the presence of oxygen. It produces acid byproducts. You can see there that there is no CO2 leaving. You got oxygen not entering, you don't have any CO2 leaving, so ATP is going to be less. And then you start seeing different increases in acid actually going into the bloodstream. Many diseases alter the permeability of the membrane, so it may have some destruction to the cell membrane wall. It may have like forcing fluid in, or like drawing a fluid out and drying things up. So ineffective cell membranes can allow substances that shouldn't be in the cell inside. This could interfere with the regulation of water, increasing fluid buildup in our bodies or causing dehydration. All of this is part of our homeostasis. Homeostasis is where we want to be at. This is where our bodies are in the most perfect setting. Homeostasis is regulated in the brain. It's maintained through our nervous system and through messaging. So our brain's able to control how much water goes through, how much energy is being used. It can register like, oh, our heart rate's going up. We're going to need to start moving more oxygen in. This is why we start to breathe a little faster. A lot of this is controlled by the medulla oblongata and the hypothalamus glands. So it's all included into our brain, but they are their own small systems. Like I was saying, your body will respond to specific actions. So the parasympathetic, think of this as like a pear, not like a fruit, but a pair of people. It's the feed and breed functions. It also is reduces the heart rate. It reduces our blood pressure. You're going to see a lot more of this when we get to medications, especially like street drugs. This is a huge one for opiates. So neurotransmitters in our brain, neuro being like nerves, transmitters, just think of it like sending signals. It sends signals to the body to start digestion process. It also is about reproduction. Sometimes when bad things are happening and you're under stress, you don't really feel like procreating. Under high stress, women have been known to have miscarriages. Our body goes into this this system where it will shut down unnecessary things. So feed and breed is more of a rest and relaxation type response to the body. So parasympathetic, the opposite of that. So this is the relax, and the sympathetic is the fight or flight. This is why the women will have the miscarriage. This is the energy. This is part of our ancient caveman days where we'd see a dinosaur or a lion and our pupils will get super bright or super large. They'll get like where you see like these large black pupils in our eyes. They want as much light as we can. We want to be able to see the monster that's chasing us. We want to be able to see whether there's a good hiding spot in the bushes next to us. Our body is going to want to run faster, run longer. So we're going to start breathing a lot faster to get that aerobic. Remember what I was saying earlier, oxygen. So aerobic metabolism. It'll increase better energy and will keep us from getting acidic. It enhances the body to protect itself. It allows us to circulate blood faster. All of this is included in that fight or flight situation where we need to have more heightened sense of what's going on around us. At this point, you should have already had some of the basics of anatomy and physiology in the cardiac or A&P section about the cardiopulmonary system. So just kind of brush through the cardiopulmonary system fairly quickly, but I want you to recognize that it is affected by disease processes. It is going to be affected by the parasympathetic and the sympathetic systems. So this is really important in how we treat patients, the medications that we're trained to use, and recognition of shock and whether we need to intervene or if this is something that we can just kind of assist with to help them recover. So cardiopulmonary system, it's basically your heart and lungs. So respiratory and the cardiovascular systems working in conjunction, bringing oxygen into the body, putting it into the cells, and getting rid of the waste, getting rid of the ability to fill the body with acid. So that's putting it into the kidneys, which send it down the GU system, and it gets expelled in our waste, or exhaling out our carbon dioxide. Any breakdown in this, any breakdown in the lungs, the airway, the heart, the blood vessels, the blood themselves, can result in system failure. So airway, the bronchial tree, it stems down and then splits to the right and the left bronchus. And then it stretches down even further into the bronchioles. Below that is the alveoli. These are little balloons, essentially. They stretch, they fill with oxygen. They're important to have some moisture in there, but you don't want them filled with water. This is where you'll drown. If you get water in there, there's no transfer of oxygen and carbon dioxide, so you can actually drown. In the alveoli, that's where all the nutrients that you inhale, nicotine in the cigarette smoke, the drug or nicotine in vapor from like people that are vaping, smoke from a structure fire, all of this is where it gets transferred into the cells, into the body. So it's really important to be able to recognize it's not just damage to the outside, but down to the cellular level when you inhale substances. You must have a patent airway for the body to system. If you can't breathe because your airway is closed, whether you're choking or being strangled or hung, you need that to be able to intake air. Most common obstructions is going to be your tongue. Otherwise, it's going to be foreign bodies. So the reason they have a hole in a lot of candies, like Lifesavers, is if the child inhales it, they're still able to get some air by. Other airway obstructions could be infection. Tonsillitis will close off the airway. There could be trauma involved that causes an airway closure. The lungs is the lower part of the airway. We assess it with tidal volume. That's each breath, how much is in there. And then we get our minute volume by counting how many breaths per minute. And then that tidal volume, this is going to be used when we do, if somebody has to be ventilated, how much bag valve mask squeezed. This is why the bag valve mask is actually very large for the average person's lung capacity. You don't want to squeeze the bag too far, especially if you're dealing with a small child and you have an adult BVM. You could pop a lung. You can go beyond that tidal volume. Any change in the tidal volume or respiratory rate reduces the minute volume. So you could be breathing at 18 times a minute and taking regular breaths and you're well oxygenated. Now you try to breathe 18 times a minute, but only small inhales, or you try to breathe through a small straw. You're going to reduce the minute volume, even though you're breathing at the same rate. Any respiratory dysfunction, it could be caused by respiratory control in the medulla oblongata. It can be affected by drugs, trauma to the head, a fall. You can see this with like traumatic brain injury. You can see this with concussions. Seizures can lose control of their respirations. Many different events can impact the function of the medulla oblongata, and then this in turn will affect the minute volume, either by reducing the speed that we breathe or the volume that we breathe. Disruption and pressure is so we don't actually like breathe in, we don't breathe out. We basically, the diaphragm goes down and it creates this vacuum. And to fill in that space where the diaphragm move down, air goes in. And when the diaphragm relaxes, this is why it's passive. Basically, it kind of pushes that air out. And so the pressure becomes positive, and it's higher pressure in the lung space, and it gets pushed out of our mouth and nose. If there is a hole, this pressure will not be developed. You can't blow up a balloon to full capacity if there's a hole on the side of it. This could be compromised by fluid. It can be compromised by air in the outside area of the lungs. It could be blood, and you'll learn that a lot more in your trauma sections. Different trauma or medical problems can compromise the ability for the alveoli. Remember those balloons at the bases of the lungs? Less oxygen gets in, and then less carbon dioxide gets out. When carbon dioxide can't leave, we start to get acidic. Another word for increased carbon dioxide levels is hypercapnia. You're going to learn about getting capnography, which is, it's not a new tool, but it's new to the basic level of the AMT1 for state of Alaska. And it's being able to graph or read the capnography or the capno of the body. So looking at the carbon dioxide levels that are being exhaled outside the body. So we talked about the medulla oblongata being able to regulate, but what does that actually mean? Respiratory compensation. The body attempts to compensate for any deficits. Chemoreceptors, they basically register how much oxygen and carbon dioxide are moving in and out of the cells. The brain will stimulate the body to increase how fast we breathe, how deep we breathe, according to what it believes the deficit is. Blood. There's 4 parts of blood. The plasma, or the liquid, it's the largest part of the blood itself. Red blood cells, which carry oxygen through the hemoglobin. White blood cells, also known as leukocytes. There are disease fighters, so they fight off infection. Platelets, also known as thrombocytes, help to form clots. Proteins in the plasma, remember that's like the more liquidy part of the blood. The proteins will attract water away from or around cells and then put it into the bloodstream. So if the proteins say that we need more water into the bloodstream or moving it into the cells. Hydrostatic pressure, water is pushed back out of the blood vessels and then towards the cell. This here is when our body wants to increase the pressure, start feeding the cells more. Any problems with these proteins can cause an imbalance or a change in our homeostasis. Blood dysfunction. Without enough blood, you can't move oxygen around, you can't get rid of the carbon dioxide, and you can't function with the appropriate energy. Things will start to malfunction and eventually die. This could be caused by bleeding, so the lack of the blood. It could be due to dehydration, and there's a lack of blood or the lack of area to hold the cells that will carry the oxygen and carbon dioxide. Maybe the cells are kind of shriveled up and the structures inside the cell are not able to function. It could be caused by anemia, so there's not enough hemoglobin or oxygen carrying abilities in the blood itself. And it could be liver failure, unable to get substances in and out or filtered through the blood. Blood vessels, a little bit of refresher on the anatomy, physiology. Arteries move away from the heart, veins move towards the heart, and the actual exchange is done in the capillaries. So blood vessels, they take oxygenated blood from the lungs via heart to the capillaries in all parts of our body. Then it returns this blood back to the lungs and then the heart for that gas exchange. This all happens between cells and capillaries and then the alveoli and capillaries. We do need adequate pressure to make this work. This is where too low blood pressure or hypotension and then too high of blood pressure, hypertension, comes into play. This pressure is controlled by the diameter of the blood vessels. If our blood vessels are too large, the amount of water or the amount of blood in them is not going to be able to sustain that pressure. Stretch receptors will monitor this pressure and either constrict or make the blood vessels smaller, increasing the pressure, or it'll make them relax or dilate and decrease this pressure. Think of it like a garden hose and a 5-gallon bucket of water. So you get a funnel and you pour the 5-gallon bucket of water into the funnel and then through the garden hose. It's going to kind of fill up the garden hose. There's going to be a nice flow. It'll make it all the way through the hose and come out the other side. So we have that same 5-gallon bucket of water, but instead of a garden hose, we have a 5-inch firefighting suction line. You pour it into that and it might not move all the way through that suction line. It may stop halfway through unless you have a hill to make it kind of flow through. It may not flow at all through it. It may just kind of sit stagnant. So the diameter of the container itself is important. Or we have the garden hose and you have the 5-gallon bucket and it flows through nicely. Or you have the garden hose with a cup of water. So the container stays the same, but now the amount of blood or the amount of fluid. So dehydration really takes a role in how much pressure is in the blood system. Could have a loss of tone, so they're not able to constrict or dilate. We'll see this in shock. They're not able to control the pressure. It could drop. This can be caused by trauma, infection, or allergic reaction. You're going to learn about hemorrhagic shock in trauma. You're going to learn about septic shock with infection, and you're going to learn about anaphylactic shock in allergic reactions. So normal vessel, see how much blood, it fills up the entire vessel. The one on the right is a dilated vessel. It's the same amount of blood, but it's a reduced blood volume, so reduced pressure. With excessive permeability, capillaries will leak fluid out of their walls. If they leak the fluid, they're not able to make that exchange. This can be caused by severe infection or sepsis. High altitude will also do this, and specific diseases will cause capillaries to excrete too much fluid out of their walls. Here you can see how the capillaries are leaching out that fluid instead of keeping that fluid to be able to use for appropriate exchange. So if you're losing all your fluid, it's going to change your blood pressure. What is the term for high blood pressure versus low blood pressure? Hypertension. The pressure inside the vessels actually increases. This is high blood pressure. Various conditions can lead to high blood pressure. High blood pressure itself can lead to more diseases, including stroke and heart disease. Loss of regulation, so chemical messengers tell the blood when to dilate and constrict. If there is a change in these chemical messengers, if the signals are blocked, so there is cells that are actually being blocked, lack of sympathetic response. So they don't have that fight or flight response. They only have the parasympathetic and causing them to dilate. That can cause shock as well. So we talked about the fluid. We talked about the piping. Now we're going to talk about the pump, the heart. The pump with the average stroke volume, or the output, of about 70 milliliters per contraction. So every time it squeezes, it's about 70 milliliters that it squeezes through. The stroke volume is the preload, the amount that's coming back to the heart. The contractility, how much it squeezes, and then the afterload, so that pressure that the heart has to pump again to force blood out and into the system. You have to have that blood pressure. You have to be able to maintain those open blood vessels to get the flow to continue. The stroke volume, so you're looking at the amount coming back to the heart, the squeeze itself, or the pressure that is being pushed, and then that pressure in the residual rest of like the system that it has to maintain to get it to go and flow. That's that 5-gallon bucket in the 5-inch suction hose. So you need to be able to have that pressure. That's your stroke volume. You times that by beats per minute, and that's going to be your cardiac output. So the total. Anytime you slow the heart rate or you decrease that stroke volume, it's going to reduce cardiac output. So you can have a high stroke volume, you've got high pressure, large squeeze, but very slow. You can have that same cardiac output as someone that has low pressure and faster heart rate. Being able to compensate for specific needs is where you're going to see some of that changes in either the minutes or the stroke volume, but continuing the same cardiac output. A very fast heart rate will reduce the cardiac output. It's mainly because the volume caused by the contraction is not going to be able to be the same as if it had the full time to refill. It can only move so quickly and be able to fill up. Passing a cup under a running faucet slowly is going to get it to fill up, but passing it just in a quick motion, you're not going to get a full cup. So if you do that over and over, the heart's not going to get a good cardiac output. So even if you do go too fast, pretty soon that stroke volume will decrease on its own. Hopefully that makes sense. Think of cardiac output as filling the glass. You need to have enough time. You need to have enough flow going into the glass. You need to have a big enough glass. And then it all is about the speed that you go and put the glass under the faucet. Kids, peds, man, they have adrenals to go and go and go. But once they fail quick. They rely on their heart to do all their compensation. They don't have as well of muscle development in their blood vessels. They don't have as well of thermoregulation and chemoreceptors and all these baroreceptors. So they really rely on the heart rate to compensate for their poor perfusion. So if the stroke volume, they're losing some of that water, that blood, they're going to have to make it up by beats per minute. And I want to emphasize that beats per minute, the faster it goes, the less cardiac output it will eventually get. So when you start seeing kids having a higher heart rate, you need to be concerned that it's not going to last very long for them. They're not able to increase that contraction, and they're not able to contract the muscles around or tighten those blood vessels as well as adults. So when they crash fast. Different heart dysfunctions, there may be mechanical problems. The actual heart itself may have problem squeezing. It may have some damage to the muscles from like the heart attack there. The actual muscle itself is unable to squeeze. There could be a hole in the heart from some sort of trauma. There could be electrical problems. So the signals are not getting sent to the appropriate muscles of the heart, or the heart is not beating at the appropriate rate or rhythm. So blood is not flowing as it needs to be. So we're putting it all together. Cardiopulmonary system. We've got the heart, we've got the lungs, we've got the blood, the vessels, everything. There needs to be a balance between oxygen and carbon dioxide. There needs to be a balance of water or fluid going through. Anytime there is a mismatch, there's going to be a challenge, or there's going to be interruption of the cardiopulmonary system. This creates shock. Shock is the hypoperfusion, so lack thereof or inadequate perfusion. Perfusion is what we want. We want oxygen and nutrients to the cells. We want waste out of the cells. So we need the water to be able to get the functions inside the cell working. We need the energy provided by glucose and oxygen. We need waste being removed so we don't become acidic. This is all part of perfusion. Hypoperfusion is a breakdown of the system. This can actually result in the death of a patient if it is not resolved quickly. There's 4 categories of shock. Hypovolemic, so inadequate, volemic being volume or low blood volume. Distributed, this is low blood vessel tone. So this is the 5-inch suction hose. Cardiogenic is the pump itself. So the heart, either mechanical issue or an electrical issue. And then obstructive, the blood can't flow. This is a plug. This is a clot that's happening that has stopped the flow of blood. Compensation. There are times that our body does compensate for problems in the body. We can have increased heart rate, we can have increased respiratory rate because our body's going to go into a fight or flight. It's going to want to increase that heart rate to get more oxygen to the cells. It's going to increase respiratory rate to try to get more oxygen into the bloodstream. It may start shunting blood vessels, kind of constricting them and making them smaller to try to increase the blood pressure. If there is lack of fluid, it's going to want to tighten those blood vessels to make that lack of fluid still fill up the blood vessel to create that pressure. So you might not see much of a capillary response because they're getting tightened. They're not getting the fluid that they need. They're not able to make an appropriate gas exchange, which will indeed cause some sort of shock. If they're not getting the exchange, you're going to start getting pale, cool, clammy skin that is not getting the oxygen and nutrients to the cells, to our skin, and it's not getting rid of the CO2. So it's going to start turning blue. If it doesn't get enough oxygen, it will be cold because it's not getting that nice warm blood. You can start getting sweaty. There's a malfunction in the body system to be regulated normal. There's no more homeostasis. The biggest thing is a slight mental status change. Any change to the body system, we're going to have some sort of mental status change. That could be confusion, agitation, could be worry. Anything that is out of the norm could be the first sign that you get when recognizing compensated shock. Decompensated shock occurs when they're no longer able to compensate on their own. Those mechanisms that it had before, the shunting from the capillaries, increasing the heart rate, increasing the blood flow by constricting, increasing the respiratory rate, not able to compensate, not able to keep that blood pressure up. So instead, you can see the heart rate up, but now the the blood pressure is going down. That respiratory rate went up, but it's not doing its job, and that blood pressure is still going down. Their mental status is still going down. Irreversible shock is when they have not perfused. They're not perfusing adequately. They haven't been able to compensate. The blood pressure started going down, and pretty soon they can't even keep that elevated heart rate or that elevated respiratory rate, because even those cells are starting to die. Patient's death commonly follows the irreversible shock. They're going to need intervention, including blood products. With decompensated shock, they're going to need intervention of fluid, not necessarily blood, but either fluid or drugs to create more of a compensation for the shock. Pathophysiology of other body systems. Fluid balance. Most of us are more water than anything else. We have some in the vessel space, so that intravascular, there's intracellular, which is 70% of our body. Most of it is in some sort of cell, whether it's in cells of organs and tissues or it's in cells in blood. We need that water to be able to move electrolytes, to be able to move energy and other substances and nutrients throughout the body. And then interstitial is 25%. That's basically our reserves and the fluid in between joints and muscles and everything that keeps things fluid and moving. So we're not all stiff everywhere we go. So 70% of total water is intracellular. 60% of your body weight is water. 5% is in the blood vessels around all the cells, and then 25% again is in between tissues, so interstitial. Our brain regulates so much of our thirst, and it sends signals to the kidneys to be able to eliminate waste and excess fluid. The plasma proteins will pull fluid in and out of the blood cells. We learned that earlier about the proteins. The cell membrane and the capillary membranes will regulate the flow in and out. So the proteins will want to pull fluid into the bloodstream, and it really depends on the permeability to regulate that flow. So everything kind of works in conjunction. If your body wants more water, it'll increase your thirst. It'll give you that desire to drink more water. Disruptions in the fluid balance. Fluid loss could be from not drinking enough on a hot day and then working out. It could be from trauma to where you've been bleeding out. Poor fluid distribution, water not getting to where it needs to go. So it gets stuck in the feet. That's where you're going to get that edema. With certain cardiac problems, certain problems that the pump's not going and pushing fluid appropriately. Maybe there is no vascular resistance to keep the flow moving. Nervous system, how does the brain send signals to the rest of the body? From the medulla oblongata down to the heart, to the lungs, to the diaphragm to make us breathe in and out faster. Well, it's all with the nervous system. So brain and spinal cord are well protected by bone as well as muscle. And around this layer of protection is meninges. It's kind of this coating that covers over it. And then there is cerebrospinal fluid that helps the kind of like the lubricant between the brain and the tissue or the bone around it. So you've got your brain and then the cranium. It's not just dry in there. It's got to have some fluid. So it's got the cerebrospinal fluid. It's got meninges that go around the spinal cord to protect it. So it's not just rub and raw against the vertebrae or the bones. Nervous system dysfunction can be from different traumas, motor vehicle crashes. You'll learn more about reading or interpreting mechanism of injury, depending on the motor vehicle crash, depending on the height of the fall or how the person's landed, and then diving accidents, hitting their head at the bottom of a shallow pool. This can all cause nervous system dysfunction. Medical dysfunctions that damage the nervous system can be from strokes. So the brain itself is not getting the nutrients, the oxygen, the glucose that it needs. And so part of it starts to die, and then the brain's not able to send signals to the appropriate body parts. Could be from infection. If the meninges get infected, it causes meningitis. There's bacterial meningitis, which is more fatal than viral meningitis. The encephalitis is another infection that affects the brain. Could be from disease. So ALS, also known as Lou Gehrig's disease, the person will be able to function mentally appropriately. They know everything that's going on. They're fully aware of everything that's happening, but their brain is no longer able to send signals to the rest of the body. They're not able to walk. They're not able to stand. They're not even able to feed themselves, control their own bladder or bowel. Pretty soon they're not going to be able to swallow or breathe on their own, and they will die fully aware of everything that's happening to them. Lastly on the list is low blood sugar or hypo, being inadequate, glycemia, so glyco, like glucose or sugar, and then emia being related to the blood, so low sugar blood. Diabetics, if you have low blood sugar, you're not getting that energy and the brain's not getting fed, it's not going to send signals appropriately. That's part of the endocrine system. It's a gland that secretes hormones, so diabetes is included into the endocrine system. These hormones will send chemical messages to the body to control specific body functions. Major organs in this system include the brain, the kidney, the pancreas, the pituitary gland, the thyroid gland, and the adrenal glands. This is how we grow our height. This could be like growth hormones. This will be regulation of iodine in our body. This is the release of adrenaline in our adrenal glands. This is our insulin levels. There is so many different hormones that are created through these major systems, major organs in this system. So dysfunction in any of these organs can disrupt our heart rate, our temperature regulation. It may make us too small, it may make us too large, so body parts don't match the size of our body. It could cause type 1 diabetes with not enough or inappropriate insulin. These things can be present at birth, or it could be a dysfunction caused by an illness or damage to the body. Adrenal insufficiency, you can have too much cortisol. We've all seen the commercial with the big belly from stress causing an increase of the cortisol. There may be some medications that suppress our immune system, and they also suppress the adrenal function, make people unable to have the energy to do anything. They don't have that go get 'em kind of feeling. It may affect their fight or flight. The digestive system, this is what brings nutrients into the body. Being able to eat, getting our potassium from our bananas, being able to get calcium from our foods, to get our salt intake. We need salt for us to function. Electrolytes help make the electricity flow through our nervous system and through our body. We need that electrical impulse to make glucose turn into ATP. It needs that water to transport that electrical impulse. Major organs in this system include the esophagus, the stomach, and the intestines. Your mouth feeds into the esophagus, where it leads down to the stomach. Initial breakdown starts in the stomach and then ends up in the intestines, where it is either absorbed or excreted. Dysfunction in here will impact hydration levels. It'll impact nutrient transfer. There could be a bleed here, which will, it can cause death if it is significant enough. It can cause all sorts of other illnesses. This can be slow, or it can be pretty rapid if there's a trauma or some other significant event. Vomiting and diarrhea, you're going to lose a lot of water when you vomit too much or have diarrhea. This is especially the case with children. Anytime you hear a call for a child that has been vomiting or has excessive diarrhea, assume that there's going to be dehydration. They're not going to get enough water because their body's expelling it. Diarrhea is very loose stools, loose being lots of water. You don't drink enough water, you're going to poop out a rock hard turd. So you want to make sure that you drink enough water, and too much fluid in your feces is going to be liquid and soupy, and nobody wants that, but it's going to make you feel dehydrated. So there's many things that cause digestive dysfunction with vomiting and diarrhea. Food poisoning, motion sickness, different infections, little stomach bugs. There's no such thing as a stomach flu. Influenza is its own thing. There's no stomach flu. There is stomach bugs, and there is gastroenteritis, so issues with bacteria or viruses in the GI system. Just a little soapbox note, sorry. The immune system, it is responsible for fighting infection. We learn this in the blood, that there is leukocytes, or your white blood cells, that help fight diseases. They respond to specific body invaders. They identify them, they mark them, and then they destroy them. So first they have to find them and target them. Then they kind of band together and destroy them all. The problem with our body and our own immune system is sometimes we overreact, a hypersensitivity or an allergic reaction, when really it's not an invader, but peanuts or another substance that we enjoy very much. Our body will react to it as an invader, and it's inappropriate, and we'll start flooding the system with a massive response, very exaggerated. This could produce edema, so you have that flooding or that massive response. To get things to respond, you need water to carry it. So you're going to start getting an overloading of fluid. This is why people's lips swell up and their face swells up when they have an allergic reaction, or they get hives and there's a lot of different fluid into that area. If you lose the fluid in the rest of your body because it's all going to your face, you're going to have a drop in blood pressure because that fluid's coming from somewhere. This can be very life-threatening, especially if their tongue swells up and closes off their airway. Their lips all swell up. Their throat itself starts to close off because it's swelling up. All right, chapter review. Hopefully you guys learned a little bit in this lecture here. Pathophysiology allows us to understand how negative forces impact normal body function, how the disease actually works. So physiology is the working, and the patho being disease, so how the disease works on our body. It helps us understand how common disorders can change many systems in our body. Understand how the different compensation for adults versus pediatrics, how our body will be able to compensate by constricting blood vessels. When you constrict blood vessels, the capillaries aren't going to be able to do the exchange, so it should only be a temporary compensation. You run for a while, your body compensates. You do have to stop and rest. We do have to rest. We do have to sleep. We do have to sit, rest, and digest. To be able to go about another day. We need those nutrients, we need that oxygen, we need that exchange so we don't get acidic. Cellular metabolism requires a constant supply of oxygen and glucose. Absence of either one of those will disrupt normal metabolism. Cardiopulmonary system combines the functions of the respiratory system with the cardiovascular system to circulate that oxygen at that cellular level. Bring the oxygen in, make it go round and round, go to the cells, get exchanged out for CO2, and then get expelled out again through the respiratory system. Shock occurs when the cardiopulmonary system fails and the cells become hypoperfused, so inadequate perfusion, so hypoperfused. The body is composed primarily of water, remember 70%, and this fluid is distributed through all of the body systems. Everything needed fluid, everything with the skin, with surrounding our brain and our blood vessels around our lungs. We need some sort of fluid everywhere. Again, I hope you guys enjoyed this class covering the body systems here in the pathophysiology. And if you guys have any questions, talk to your instructor. Many of them can get a hold of me, and have a wonderful day.